guys, it's HINA Chef here at Rebalance Physical Therapy in Center City, Philadelphia, and on the main lines in Narberth, Pennsylvania. And today I want to talk to you all about what is the myofascia, what does it do for the body, how do you know if you have a problem with the myofascia, and what treatment options are there for it, and how do you know that you're seeing the right practitioner? Now, first of all, what is the myofascia? Now, myofascia is basically this collagen type structure. It's a collagen structure that basically starts underneath the skin, and it kind of is like a web that penetrates from underneath the skin all the way down through all the different muscle fibers that you have, all the way down into the bone, around the organs, and it basically is like a glue that is flexible, but it also stabilizes and keeps things kind of bound together. So do you ever wonder why you have all your organs and they're not falling all over each other? Well, it's the fascia around those organs that keeps it compartmentalized. But in order for you to bend forward and bend backward and walk and function and play sports and all these kinds of things, these organs have to kind of like move on top of each other. So they have to be mobile. But the other thing is you don't want them crashing and like falling on top of each other. So that's what the fascia around the organs does. And it's the same idea behind all the fascia that surrounds muscles as well. You know, your muscles are made of like strands of silk, or think about straws that are layered on top of each other. And to keep each strand or each straw separated, it has to be contained. And that's what the fascia around each muscle fiber does, is it keeps it kind of separated from each other. However, it does have to be flexible. So I kind of love these pictures here, and I'm going to explain to you what they are. Now think about a grapefruit, okay? This is how you can think about the fascia and its relationship to the human body. So you've kind of got, you've got this grapefruit peel right here, which is kind of like our skin, and maybe you've got some of this white substance, which is like our adipose or fat layer. And then you have these different compartments around the grapefruit, but they also interconnect with the pulp of the grapefruit. But it keeps each of that pulp separated so that all the fluid isn't crashing into each other. So that's basically what the fascia is like. And that's what it does. If you imagine like each of these are organs and each of these also are like parts of the muscle, it keeps everything nice and separated. But it also, you can squeeze a grapefruit, you can sort of kind of twist a grapefruit, so you know that it's somewhat flexible, and that's basically like the human body, okay? So if we take a look at this photo right over here, over here, again, you can see on a more, medical level, I guess, what it kind of looks like. It's this cobwebby, collagen-type substance that basically is web-like in nature. So you can see the flexibility of it, but it also binds things together, just like it does here. And again, just like those straws that I was talking about, how it separates, but it's part of a much bigger picture. Now, when people... when we say that there's flexibility in the myofascia, it's really important to understand that if you have a restriction of the myofascia in one area that is further away from the body, it can still affect something like, say, a couple inches to even, 2 or 3 feet away. So for instance, if I have something that is restricted in my hip or in my knee, and I do, I lift my shoulder like this. If it's really, really restricted and tight in one area of my body, it can actually affect the flexibility of my shoulder. And I've actually seen this in my clinic, where we've had lots of people that come in with abdominal surgeries, and they're super kind of tight and bound down in through the fascia because of scar. But one of the first things they'll tell me is, every time I lift my left shoulder to like work out, it reproduces my abdominal pain. So right away, that tells me, hey, the fascia is being affected. So if we take a look at this photo right here, imagine like a bed sheet that kind of covers the whole human body. If you pull on one corner of the bed sheet, then it's going to affect the opposite corner of the bed sheet. So this is kind of what myofascia can do. If you have a restriction down here, it can actually change the posturing of the opposite shoulder, maybe even the same side shoulder. This is just an example. And it can change the flexibility of that shoulder. And again, you can have myofascial tightness in many areas of the body. Now, this is a beautiful diagram from Anatomy Trains that I want to show you. And this actually shows a dissection all the way from the tongue down through the diaphragm, which is the muscle that you breathe out of, all the way down into the hip muscle, down into the calf, as well as into the foot, to show you that the body is not individual. They don't work in pieces. We all work together. So that even things that are going on into the foot can actually affect all the way up, and vice versa. Things that affect up here can kind of affect you all the way down. And we see this lots in many different patients and lots of different scenarios and diagnoses, how one area can affect another area of the body. And the reason why, one of the biggest reasons why this can happen is because of fascia and it being restricted in one area and it affects another area. So even if you're having, like I said, a shoulder problem and you sit there and you've already had treatment on the shoulder and it hasn't completely gotten better, could it be other things in the upper part of the body, in the abdomen, all the way down that could be affecting the way that shoulder is functioning? So that's how the myofascia basically plays a big role into it. And people that do have myofascial pain can have all types of pain. Some people that have myofascial restrictions don't necessarily have a diagnosis called myofascial pain syndrome, which is another category of, another category of diagnoses that somebody can have. But many people, and we see this all the time with everything from like our sports patients to our low back patients to our sedentary patients to our patients who are pregnant to our pelvic pain patients, everyone has fascial restrictions to a certain degree, and they can affect your diagnosis and treatment of it. But there's another set of people that might have myofascial pain, which that can give you localized pain or it can give you kind of diffuse global type pain. So I don't want to get you confused with that. So just because you have myofascial restriction doesn't mean you have a myofascial pain syndrome. But it can affect your issue or the orthopedic issue that you might be having, or even your pelvic floor issue that you might be having. So that's kind of how myofascia plays a role in the big global picture of an issue that you might be having, as it could be affected, and then it changes, everything from the range that you have in a particular joint to the pain that you might be feeling, because the myofascia can give you pain if it's restricted and it's not functioning well. And also, it can be related to other diagnoses that you might have. Now, this is another thing that is of interest that I love to explain, and when I lecture to all the physicians and residents and students that I lecture to, I also like to say, I like to talk about why people develop myofascial restrictions. And myofascial restrictions can come from anything from poor habitual posturing. So say if you tend to be one of these people that roll your shoulders forward or have a forward head and neck, well, over time you can see how it tightens the front of the shoulder or even the back of the neck. And over time, everything, if you don't lengthen it, if you don't stretch it, it's going to become tight. And so the myofascia, which is a flexible substance, can become tightened into that position. So something simple as posture can affect myofascia. Sitting, on your buttocks, when you have localized compression for long periods of time, so for instance, we're a society that loves to sit these days or drive in your car for long periods of time, you basically, when you're compressing a tissue for a prolonged period of time, you're not going to get good blood flow there. If you don't have good blood flow, that's what the fascia and the muscles need to stay healthy and flexible. And so if you don't have good blood flow there, you can develop restrictions in those areas, which again can affect your mechanics, okay? So that's another thing. Injuries, as well as surgeries, can create, changes in the tissue and in the fascia and create restrictions. So your hamstring pulls, your falls on your tailbones, your shoulder injuries, all those types of things, your body is constantly, with any type of injury, trying to repair. So it sends, all the good, fighting cells in there to kind of help heal things up. But in the process, you can develop scarring on the inside in response to that injury. And that can create fascial tension and fascial restrictions. But surgery, anytime you cut somebody open, it's like an internal scab that develops, and you can develop myofascial restrictions from that as well. So here is a pictorial kind of diagram to show you, anytime that you have any type of surgery, you can develop scar tissue inside there. So imagine, again, like that internal sheet, if you develop scarring in there, it can affect the myofascia that goes around all of the intestines or the bladder or the liver and all this kind of stuff. So any type of surgery can affect the myofascia in that fashion. And so, but however, okay, you can have all of these injuries, but the other thing that can affect myofascia is actually having chronic inflammation within an organ. So this is something that we typically can definitely see in our pelvic floor patients that are having any type of, that have had any type of a chronic organ type issue. So for instance, someone who's had a chronic inflamed bladder or a chronic intestinal issue. So some of these things, some of you guys, this might not pertain to, but things like endometriosis, interstitial cystitis, chronic yeast infections, polycystic ovarian disease, any type of gastrointestinal issue that you can name, colitis, all of these types of things you can develop changes in the fascia in response to the inflammation that's going on in that area. Okay, people, even in an orthopedic condition, if you've had chronic nerve irritation, that can change the way that the fascia behaves, and that can constrict. So for some of you that might have a chronic nerve compression or a herniated disc or something that's pressing on a nerve, that can change the way the muscle responds, and the muscle becomes tight. And if that's been there for a while, your fascia is going to change. It doesn't automatically, just because the nerve compression is gone doesn't mean that the muscle automatically goes back or the fascia goes back to its original state. So I hope that helps you understand why you might be getting some myofascial restrictions, or it could be a combination of a lot of those things. And I usually tell my patients, you're a layer of an onion. People start having injuries way into their adolescence, and then you just layer things on top of each other as you get into your 30s, 40s, 50s, and then you start developing pains and you wonder why you're in pain so much. So now, how do you treat myofascial restrictions? So body workers, physical therapists, and other healthcare providers, okay, I'm biased because I'm a physical therapist. Physical therapists that understand the myofascia, and not only what's called the superficial myofascia, so the myofascia that's underneath the skin or even the superficial muscles, but also understands the organ-related fascia, okay, and knows how to treat that. That is basically the person that you want to see, is someone who understands how to treat not only the top layer of the myofascia, but also the deeper layers that can go all the way down into the organs, especially if you have been dealing with a chronic issue for a long period of time and it hasn't necessarily gotten better, because the fascia affects each other. Everything's interconnected, like I showed you in that model. So there's several different techniques, depending, some of them can be very light in nature and some can be more aggressive and deep. And someone who truly understands how to treat the body holistically, that understands how to treat not only superficial myofascia, but deeper in and around the organs, that will be probably the person that most likely has a really good understanding of how to treat this. And of course, the type of technique that you might need might vary from one person to the next, depending on how easily flared you get, and also, your tolerance to different techniques. Sometimes all a practitioner needs is their hands to release myofascia, but sometimes there's different tools that can get involved in improving myofascia. There's a certain technique called Graston technique, which is a technique that was originally developed by Oriental medicine called gua sha, and now we've kind of modernized it. And so there's different tools as well as hands that can be used in a very particular way to release myofascia. Now remember, myofascial restriction, it's part of a bigger picture. It's not that just releasing the myofascia may take care of all of your issues. Myofascia needs to also be treated in conjunction with all the other imbalances, potentially muscular trigger points that you might have, as well as imbalances in strength and length of muscles as part of a bigger picture. So I know this was a long video, but I hope this was an in-depth video for you to really truly understand what the myofascia is, how it can become restricted, and what you can do about it, and how it might be potentially be playing a role into what you might be feeling. So if you are living in and around the Philadelphia area and you can come to us and you happen to have an issue, it's a no-brainer, come see us. Come to our website, rebalancept.com. That's REBALANCEPT.com. We have lots of other YouTube videos that you may watch and help you understand how everything kind of combines together with the myofascia and how it might relate to you. Have a wonderful day.